Yeah.
Okay, you are ready? Okay, my name is Dr. Zipporah. Zipporah is a lecturer at KISE, Kenya Institute of Special Education. Basically, we are in Nairobi, although we are spread across this country in different centers where we train teachers to handle learners with special needs of different categories. We also do assessment for learners that have issues or disability. We assess them and equip them with the right devices, and also for placement in schools that need, where these learners need to go and study from. We also do rehabilitation for persons that have lost either a limb or they've lost sight senses, like sight or hearing. We rehab them and return back to the community so that they can function like almost normal. We also make and sell our devices at some fee, and sometimes we donate to schools. And during this Deaf Week Awareness Week, we are here in Rongo, Kuja School, ready to assess, to determine the hearing loss for learners, and we will place them to appropriate institutions where they need to get learning materials or services. We also train teachers and give them the guidance that they need. We also equip them with the resources, and our schools need these special devices that learners use, teaching and learning materials for teachers. We manufacture them and we also give them to schools for use. We also have another mandate as KISE to do guidance and counseling to our parents. It is common knowledge that after one has had a baby, they just celebrate the band of joy. Then later in life, as the child develops, they realize that my child is not able to speak, is not able to respond to normal situations. Then later they seek for services. When they come to us, we also realize they need some guidance and counseling. We talk to them so that they can accept their situation and be able to live well with their child. Where we can, we equip them with sign language for them to communicate with their growing deaf persons or persons that have hearing loss. As KISE, we are happy to be in this place celebrating this awareness together with you, and I'm sure we're going to reach up to many in the society around here because we are offering that service for free. So we encourage the society, the people around here, to make use of us now that we are on the ground. We have brought the services for you. We will assess them, those that need audiology tests, and possibly determine their needs and advise where necessary. Otherwise, thank you so much. We appreciate also for the organizers of the event because we got a privilege to come around. Thank you.
Okay, I have a question.
Yes, please.
As KISE, by the end of this week, what do you expect?
It is our wish that we would get as many young persons as possible, and not necessarily young person, even people that have losses, hearing loss or sight. If they come to us, we will give the right guidance, and where possible we will assess and also advise accordingly. We're also happy that we've interacted with the teachers around here, and we encourage more teachers to come to KISE to learn, get skills so that they come back and impact. Like you heard our guest speak today, he said that from all departments in the county, we will have at least a sign language interpreter and persons that understand people with disability. It will be good so that we can have an inclusive society.
Now, while moving around,
yes,
do you find challenges, and how have you overcome them in terms of getting these people maybe who are having challenges in speaking and all?
Yeah, I can say that the society today is better improved than a few years back. There's a lot of awareness, so as we move around, we are getting young people, but we still have a challenge with awareness to some areas, especially the interior parts of any place we go. The remoter the place, the less the awareness. And there we have persons with disability that are, I can say, are hidden or they are not exposed, either by lack of knowledge from the caregivers, or the caregivers are still ashamed of the child that has this hearing loss or that disability, therefore they don't want to expose them for fear of stigmatization or for fear of what I can't understand, because if they expose them, the earlier the better. We advise parents also not to keep quiet when things happen to them, because KISE is there for them. Nimeongea aje?